And so applying a 20% estimate to the U.S. autism figures for young people ages 6 to 21 in full-time education will give the UK estimate of about 87,000. Now, the cost of that, if it were shown that it were due to the vaccines, would just be astronomical. And therefore, one more reason for cover-up. That said, let me involve our panelists now, and I will be interspersing important information as we go. Dr. Henry Wakefield will be my first guest. My second guest will be Jim Moody. He is Dr. Wakefield's U.S. Attorney and current director of the Family Advocacy Organization in the National Autism Association and the research think tank Safe Minds. And he consults with the Petitioner Steering Committee on Autism Cases in the Vaccine Court. My second guest will be Clifford Miller. He is a major barrister, a solicitor of the Supreme Court of Civil Proceedings in Great Britain, and he specializes in matters involving vaccination science. Then Dr. Edward Yazbak. He is a board-certified pediatrician since 1963, a fellow of the American Academy of Pediatrics. He is a medical expert for the Social Security Administration Office of Disability Adjudication and Review, a former assistant clinical director of the Charles Chaplin Hospital, an associate member of the Institute of Health Science at Brown University, and director of pediatrics at the Woonsocket Hospital in Rhode Island. So for more than 35 years, he has been a practicing board-certified pediatrician, and also he is a research scientist on autoimmune regressive autism and vaccine injury. He's extensively written and published in peer-reviewed journals. More importantly to our discussion, Dr. Yazbak's grandson is autistic and was treated at the Royal Free Hospital by Dr. Wakefield and Walker Smith. And finally, Isabella Thomas, who has two autistic children who were part of the original 12 patients at the Royal Free Hospital study, and also a person who is speaking out on behalf of other parents. And I will also read a separate report from one of the additional parents who today gave me a special insight on her child's condition. Therein is our study. Let us begin. Nice to have you with us today, Dr. Wakefield.
Hello, Wakefield.
Nice to have you with us. Dr. Wakefield,
thank you so much.
I will be at, you were attacked on my program, and therefore I felt necessary to bring you on to have you address the issues that Brian Deere had stated. You'll have an opportunity hearing his exact, in context, unedited statements, and then if you would give us your response and, wherever possible, documentation to support your response. All right?
Certainly, Gary. And may I just say congratulations on taking an in-depth look at this. It's so rare amongst journalists now that actually takes place. So well done.
Thank you. Let us begin. Let us hear first the first challenge by Brian Deere towards you. Let's get our audio going from my engineer, please. Okay, we're having a little computer difficulty. As soon as that's ready, I have the actual transcript, so I will read it. It's squarely an allegation against Wakefield. He did it. Now, the quote, this is Deere. Quote, the other authors didn't actually know which child was which. The other 12 authors really couldn't speak to the veracity of the data. He claims based on their medical records and the information that they provided to him, but in fact they didn't know. So that's involving his statement against you. Would you respond, please?
Certainly, Gary. Let me just put this in context so that people understand the nature of Brian Deere and where he's coming from. His first foray into investigation of autism, at least the first that I'm aware of, was gaining access to the home of a mother, one of the parents of one of the Lancet 12 children, under a false name, and claiming that he was a health correspondent from the Sunday Times newspaper. Now, this is an extraordinary piece of journalism that he lied to a distressed mother whose child was severely injured in order to deceive her, and has expressed on the internet that he is proud of having done so. And that really is someone that we need to look at very, very carefully when interpreting what he's saying. Now, in terms of his first allegation, it was Wakefield that did it. This seeks to isolate me from my co-authors. There were 13 authors on that paper. Between us, we published thousands of scientific and medical papers in highly reputable journals. It's extraordinary that these colleagues of mine would suddenly have an absence and forget to check the records of these children who they investigated clinically prior to publishing. In fact, what Mr. Deere has done is to conflate 2 time points. When we published the paper, all of my colleagues knew who these children were. Indeed, they'd investigated them. The findings were fascinating. They were very concerning to all of us. And when the paper was published in 1998, all of the authors had an opportunity to check the data to make sure that what was in the paper was truly representative of their clinical findings. Not my findings, but their clinical findings. However, when it came to 2004 and Brian Deere's allegations, there now has been 6 years of time elapsed. My colleagues needed to be reminded who the 12 children were in terms of their chronological order. That was what actually he was referring to when they said they didn't know who the children were. When the paper was published, they knew exactly who they were. 6 years later, they needed to be reminded. And that is an example of the way in which his misleading journalism has created this perception of deceit.
All right, let's go to some specific clips and what he stated in an interview with me 2 days ago. If my engineer has been able to get the clips, we'll take them. Go, please.
He had no IRB approval to do this kind of research on young children.
Your response, please. Did you?
Thank you, Gary. As you have already pointed out, there was the research that was done, that was published in The Lancet, was research on biopsies. Specifically, it was an expert review, a blinded review. That is, the senior pathologist did not know the histories of the children or their diagnosis. He merely gave an interpretation of the disease findings in their intestine. And that research was covered by the ethical approval, or IRB approval, 16295, 95 referring to the year 1995 that it was awarded, and it encompassed the work that was done. So yes, this work was covered by an appropriate ethical approval. That ethical approval was known to Mr. Deere and was in his possession, but for some reason he appears to have not disclosed it to the General Medical Council in evidence, and it was in fact adduced in evidence into the General Medical Council proceedings only by Professor Walker-Smith and his team. Unfortunately, that was too late, and it did not have the impact that it should have had on the hearing's outcome.
I also understand that he did not give all of the documents of approval, only 2. Let's go a little further with this. I have another clip. Please respond to it.
He fabricated the findings both by manipulating the admissions criteria for the study, where he was bringing in specific target children.
Respond, please.
I'm not quite sure what he means by that, but let me tell you what I think he means, and that is this issue of disintegrative disorder. Disintegrative disorder and autism are part of the autistic spectrum. Their presentation is virtually identical. They are indistinguishable. The difference between the two disorders is that in childhood autism, classical autism as described by Leo Kanner, the child was usually problematic from the very beginning. They had problems from their birth. They didn't want to be picked up or make eye contact or anything like that. Disintegrative disorder, on the other hand, requires a period of normal or near normal development by definition. And that is exactly what the children had who came to see us. Now, we knew nothing about this at the time, so we asked the child psychiatrist, Mark Gorilovitz, to get involved because he was an expert in this field. And when he heard the histories of these children, he said, this sounds to me much more like disintegrative disorder. And so the original protocol that was brought together to investigate these children, the one that was never used, in fact, 1972-96, described disintegrative disorder. As it went on, as the study went on, as more and more children came in, it became clear that this was a regressive pattern of autism. The rest is semantics. They had regressive autism that was indistinguishable from a disintegrative disorder. So there was no manipulation of the inclusion criteria. The children were seen for clinical reasons, first and foremost because they had intractable gastrointestinal symptoms from which they were suffering, which no other doctors appear to have taken seriously.
We'll continue on. Another challenge for you.
He also went through the results, manually altering test results and diagnoses and histories of the children so as to create the appearance that there was a link between MMR and autism.
Hi, Gary, and this is the crucial point, and this is really where you have trapped Brian Deer in the big lie, because this is an extremely important point, and I'm going to go through this so that your listeners understand in very simple, very clear terms what actually happened. Let's take, first of all, the clinical histories. Now, each child was referred to Professor John Walker-Smith in the Department of Pediatric Gastroenterology at the Royal Free for their clinical symptoms. And Professor Walker-Smith was sent a referral letter by the primary care physician. That was either a pediatrician or a general practitioner. So we had that evidence in the referral letter. The letter was based upon the medical records held for each child by their primary care physician. We did not have access to those records. Those are the records that Brian Deer has compared with the Royal Free records. Remember, we did not have access to those original primary care physician records. All we had was a referral letter. What we had in addition, which was very helpful, is a thing called the Red Book. Now, in the UK, every child has what is called the Red Book. And the Red Book records their immunizations and their health. The mother keeps the book, and a health visitor, a senior nurse, comes to the home on a regular basis for every child and does a formal developmental assessment, a prospective developmental assessment. And those records were used as a very good measure of the child's early development. Brian Deer did not, by his own admission, have those records. So how he can say that what was written in the Lancet paper differed from the childhood developmental records, I do not know, because he at no time was in possession of those records. So what we based our appraisal on and what was included accurately in the Lancet paper came from the GP's letter, it came from the Red Book, the prospective developmental records, and the fresh clinical history taken by Professor Walker-Smith at the Royal Free. And that was faithfully and accurately transcribed into the paper itself. Brian Deer, on the other hand, provided a comparison in the British Medical Journal between the GP's primary records and what was published in the paper. We did not have access to the GP's primary records. Brian Deer knew that. And so what Brian Deer has fabricated is an inappropriate comparison. Now, let me just give your listeners an example of this and why it's so important. Take child 1. We said in the paper that the child's first behavioral problems started a week after his MMR vaccine. The mother described him as having been delirious. In the general practitioner records, Brian Deer noted that there was an entry sometime before the MMR saying mother concerned about hearing. We did not have access to that record, and the mother did not report this to us. Brian Deer claims that hearing problems are usually a prodromal symptom of incipient autism. However, and so in comparing the GP records with what was written in the Lancet, he has alleged that we committed fraud. When we got access to those general practitioner records during the General Medical Council hearing, then a simple perusal of that entry in the GP record showed that it said, mother concerned about hearing, discharge.